Good morning, everyone. My name is Samuel Stevens, and I'm going to be presenting on rotator cuff impingements and tears. So first, what is the rotator cuff? It's a group of four muscles. They surround the shoulder. They keep the shoulder together. Does anyone know what 2 points the rotator cuff muscles are keeping together? No? The head of the humerus and the glenoid cavity of the scapula. So your rotator cuff surrounds it. It keeps it together, so when you're moving around, your shoulder doesn't come out of socket. As you can see here, the four muscles that form the rotator cuff are the supraspinatus, the subscapularis, the infraspinatus, and the teres minor. Now each one is responsible for certain movements, so it keeps that shoulder joint nice and tight. Alright. So first I'm going to talk about impingement syndrome. What is an impingement? Impingement is anything that can hinder the natural proper function of a joint. And what causes it? It could be anything from poor posture, tight muscles, weak muscles, tendinitis, and even bone abnormalities. As you can see here, this is a normal clavicle, nice and straight. And as you see here, this one is it's crooked, which is impeding on the shoulder. So that could lead to shoulder impingement syndrome, rotator cuff impingement syndrome, and that could lead to pain, tendinitis, and weak muscles. Often those are not, a lot of those are often related, and they both, and you usually get more than just one. So how do you diagnose it and how do you treat it? So diagnosing it is you have to figure out what like a therapist will figure out what kind of pain they're feeling. We'll look at the range of motion to see and the strength of the muscles to see which muscles are weaker, to determine certain movements. Like if it's weak this way, then it would be more likely that that's where the impingement or the trouble is coming. Look at your posture, see maybe types of behavioral habits that might lead to impingement. Like me, I tend to sit forward, so when my shoulders roll forward, it can tend to pinch nerves, it can cause unnecessary tension on the nerves, and that could lead to impingement syndrome. So treatments involve strengthening, stretching, increasing the range of motion, pain management. These are some popular exercises for the rotator cuff that help strengthen the muscles. For the pain management, you might see ice, stim, massaging, even anaphoresis, which is pretty much like liquid steroids kind of, so helps the pain go away. And stretching to help get the muscles loose, getting tight muscles, strengthening to weaken the muscles to keep the shoulder nice and tight and correct any weaknesses. So now I'm going to talk about the rotator cuff tear. There are two types. There are partial thickness tears and there are full thickness tears. As you can see, a partial thickness tear is not all the way through the muscle or tendon. It's only part of the way through. And as you can see here, this is a full tear going all the way through from one end of the muscle to the other. So then there's also, within those tears, there's acute and chronic tears. Acute tears come from usually trauma, like an injury, whereas chronic is repetitive motion, say someone who's a pitcher or a swimmer. It's that repetitive above shoulder motion, and that can lead to a chronic tear from, prolonged stress to those tendons or muscles. So the diagnosis for tears is similar to impingement because it's the same area. You can look for pain, weaknesses, loss of motion is a big one. You're also going to do impingement tests. Now, I took liberty to jot a few down. I hope that you'll look into these because we will probably not necessarily have to do these, but we should be aware of them. The Hawkins-Kennedy impingement test and the Mears impingement test to see, and those would be two of the tests that would help determine the tear. So the treatment is for tears is pretty similar to rotator cuff impingement syndrome. You're doing the strengthening, the range of motion, the pain management, but there's going to be more of an emphasis on the preservation of the joint because you don't want it to get worse, so there might be more protection early on, and then more gradual strengthening and range of motion. So if you do happen to have surgery though, there is a 4-phase recovery. I did mention that on the fact sheet. There's a phase 1, which is maximum protection. You're most likely going to be in like a sling, so you don't move at all. They don't want you to hurt that new surgery. Then the phase 2. So phase 1 is around a couple weeks after the surgery. Phase 2 is moderate protection, where you're slowly increasing the strength, your range of motion, you're gently working with that. Then you have the phase 3, which is return to activity. Now this is kind of like equal to this. So if this one's hurt, you're wanting to get to this during phase 3. So you're not doing sports, you're not doing stuff before, you're just getting to normal activity. Phase 4, that's the return to like occupations and sports. So like, if you're a pitcher, finally getting back to pitching. This is where you're getting like your household chores done that you might not be able to do. So this whole four-phase recovery is around 4 months, give or take. Different patients take longer or shorter.